Hi, it's me again. Different location today. I'm in my camper, scratching my hair again. Yeah, so I thought I'd come in here and a bit quieter. Yeah, so I think I was up to the point where I was due to have the biopsy, and I was laid in a very dignified position. I think I forgot to tell you, Tim, when I was just about to go into the room, he said, could I have your permission for Verity to check your prostate? Verity, if you remember, was the nurse that ran through all the details. Well, I got no problems, I got no issues, so it's a nice enough lady. so I said, yeah, no problem at all. So I'm guessing she's just learning the ropes, or not quite sure why, but anyway, she probably fancied me. So anyway, yeah, so I'm laid in the most dignified position possible. And just to explain that when he tilted the couch back, my body was horizontal, as good as. My head was slightly up on a pillar, so I was very comfortable. And then I felt like I was riding a bloody cart horse. My thighs were vertical, so you can get an idea of your leg position. My knees were as wide as they would go. And then I think he twisted my feet slightly, and they put your feet into like these, well, they call them stirrups, but they're not. They're like a boot almost, with a Velcro straps over. So, and Tim, while he gets me in position, and then he goes round and he's checking the, what do they call it, the sonic, oh dear, the thing that sticks in your backside to actually see where your prostate is. Your sonar, I'm bloody getting old. Yeah, so, and it looks like, and I'm looking at this, that's a bit strange, and it's about the size of my thumb, roughly speaking, so it's nothing, it's not got something that's impossible to to go there. And on the end, it looks like it, the white surgical gloves, the plastic rubber things. It looks like he's got a finger out one of those, and I think he must have put some of the gel on it, like with women they put on your belly when you're pregnant, because these things have to have an absolute contact through to the liquid so that they can work, because they use vibration, sound, ultrasound, that's it. Which is why they call them ultrasound, because it's very, very high-pitched vibration. And if you could hear it, you'd hear a zzz. But it's so high-pitched, so intense, ultra, that you just don't hear it. It's out of your range. And the way that they work is that you have this head on it, which is a transmitter, and it sends out this signal. It's a bit like a radar. But it's not a radar, because radar's radio. And so it sends out this vibration signal, and it picks up the echo coming back. And of course the vibrations will pass through liquid bodies and things, or flesh and whatever. And it actually gets to see densities and things as it goes. So you've got a receiver that picks up the echo coming back. Now, these heads are, sorry about this, very technical. Being an engineer, it's a curse, or retired engineer. Yeah, so these ends of these probes are actually called transceivers in the electrical terms, which is transmitter, receiver, transceiver. So this transceiver is in this gel, in this finger of this glove that is put over it, and obviously he doesn't want to get it dirty with what's in my bowels, sort of So he's preparing all this while, other things are going off and getting me comfy or whatever. And he says, very good, excellent guy, he says, I'll tell you what's happening before it happens and, warn you and things. So I'm laid there, and so I turn around and Verity stood by the door, and I said, come on, Verity, you're up. So she come round, and Julie, DRE, and she was satisfied and then buggered off. So Tim Goat comes round and he says, I'm just going to feel your prostate, DRE again. So now what I didn't realise, and he didn't tell me this, and I found out later, is that he's got a piece of white linen gauze, and what he does is that when he enters, he pushes this gauze up your bowel, because obviously what he's doing is creating a liquid dam. 2 reasons: stop anything coming down and stop anything going back up. Because what he does then is it gets, I don't know, it's a tube or whatever, but he says, I'm just going to put this gel inside. Now obviously this gel is for the ultrasound to work, so he needs to fill that sort of lower end of your rectum with this liquid, so that when he puts the probe in, it will transmit through the gel and he'll always have a good signal. The thing I forgot to tell you was that this particular type of biopsy is a fairly recent type, because it's an MRI guided biopsy, whereas what they used to do is they used to put this probe in, your rectum, and then they used to go in with the biopsy needle and go through the wall of your rectum, and that had all sorts of problems with infections and things, as you can imagine. And they used to go in multiple times, and it was guesswork. They were looking, they could see it, and they were saying, all right, well, I'll go there. Not obviously quite as bad as that, but effectively it wasn't guided. So they could do a couple of dozen samples, and none of them might hit the right spot. So what they call now is I think it's a targeted transperineal or perineal biopsy. Perineal, that's it. Guided because obviously they're using the ultrasound probe, and it's from the MRI image that he knows exactly where he wants to be. And perennial, I think it's perennial, or perineal. Perineal is basically the bit between your legs, under your scrotum, between your scrotum and your rectum. That's your perineal, and that's where they're entering, going in to do the biopsy. So I'm sort of laid there, and it gets this gel and it squirts it in, and you feel it. No pain, it's just, you can feel it, and it's a bit cold. And I said, oh, that were cold. It's supposed to be warm. That's what it said on the NHS sheet. So the apologies, our ovens broke down. I thought, oh, all right, NHS. Anyway, so it says, now we're going to, I'm going to give you the, the injections to numb you. And he says, I'm going to give you 4. And I thought it was 2. So, anyway, now what they do is that, according to the NHS data sheet, it says that he injects into the perineum. I can't remember the word in now, but if you look it up, you'll know. The perineum, I'll call it. And they inject the surface. They wait for that to go slightly off, to cook for a few, 20, 30 seconds, and this needle is like, it's not fat, very, very thin, but it's long. And then they go in and go right up to your prostate, and then inject there. So he says, I'm going to do 4. He says, I'm going either side of your prostate. So, oh, right, okay, that's news. So he says, I'm going to spray you an antiseptic on you, and clean you down, make sure there's no infection. Which he does, cold and of course he's sat on a stool between my knees, so head right low down, because of course when he's doing all this, he's got to use both hands, and he's looking at the screen which is by my shoulder. So his head's down in a very close proximity, and he's sort of working away with the ultrasound and whatever he's got to do. And he says, right, sharp sting. He wasn't kidding. And of course, I relax and try and stay relaxed, because I know that keeping your muscles relaxed gives you less pain. So, of course, he goes in and, oh, yay! And of course, it's sort of stinging, but I'm thinking, I want to get this done. I need it done. So I sort of sit back and take it. So he says, right, I'm going to do the other side. So he goes in, and I'm thinking, that's just the surface. It's got to go down to the prostate yet. Oh, So anyway, he says, right, here comes the next one, the third. So I says, is that to the prostate? And he said, oh no, I've done them already. I thought, bloody hell, you should have done the surface first. So anyway, it then does the surface, and of course it still stings, and but it's bearable. If you've ever had an injection at the dentist and they go up here with the injection, you'll know that the sort of pain that you get. But of course, it's in your nether regions. And I hope anybody watching this abroad understands all this and understands my accent, because, I can only speak the way I speak. Anyway, I digress again. So he says, now we've got to give it 5 minutes to cook off. I thought, what's he going to do, fall off? So anyway, so he turns around to his mate, Dave. Dave, set the timer. So, of course, you hear the egg time, So, and off he goes. I thought, he's going for a piss, he must have a prostate problem. Or a cuppa or something, bun. so I'm laid there, in this lovely position with me rectum exposed to the world. And they all clear out, but there's just this one lady nurse, she must be, if she's watching this, I do apologise. I'm only guessing, but I'm, probably late 40s, early 50s. And of course, she's staying there to make sure that you've got somebody with you all the time. So we have a little bit of a chit-chat, and all the rest. And while we're talking, she then, of course, she's at the side of my shoulder, so she can't, I'm covered over with me gown. But then she decides to have a wander, I think, to check the clock. So she wanders round. And of course, I'm watching her walk round between my legs as she goes. And I'm waiting for it, because, she's got her eyes up in air looking at the ceiling, because she doesn't want to check out my arsehole. So, and of course I'm watching her carefully. And sure enough, you just get this little flick of the eyeballs, and you think, she just sneaked a peek. So anyway, she goes round, she's 3 minutes or whatever, and then she walks back round the other way. The only time she did, but I could have burst out laughing, but I thought, it's a bit serious, I shouldn't be laughing. I can laugh at it now. This is only, by the way, about, it's now Friday, so this was Monday gone. So it's 5 days ago. That's right, and so when she goes around and check the clock, and I said, what's the biopsy tool like? Because I said, is it a pistol or what? So she gets this thing out, and it's like, an old gas-powered hair curler that women have, with the gas cartridge in the bottom and the tongs. Remove the tongs and put a very thin needle that's about, I don't know what that is, 12, 14 inches long, something like that, attached to the end with the gas canister in. That's what it looks like, not a gas canister as such. Whether it's battery powered or not, I don't know. And she says, this is what they use, this is the biopsy tool. And she presses it, and it goes click. She says, that's what you'll hear and you'll feel. So I said, oh, great, thanks. So anyway, 5 minutes were up. In comes Tim. And of course he's about to show me his tool, and I said, oh, it's all right, the nurse has just explained. So I said, one thing you could explain to me, I said, I can understand that you're going with this ultrasound and it looks from your rectum up to the prostate. I said, how do you target it? I said, I know it's targeted biopsy. I said, but you're only looking vertically up. I says, so I know you can get it right from left to right. I says, but how do you get the elevation right? Because you can't see the difference. You're not looking at it from the side, so you can get that elevation right. And he says, a bit difficult to explain. He says, I'll show you. So what he does is that he sort of comes to the side of me and he tilts the screen round slightly, and he's got this probe in the working position, shall we say. And he says, now, there you go, look. And of course, he's pointing on the screen while he's doing this. And he says, and I'm just over 17 minutes coming up. I'll try and make it a bit shorter. He says, now, you can see, he says, look, that's your prostate there. He says, and above it is your bladder. He says, it's not full. He says, because you've just been, which I had. And then he says, if I push the probe around, and I'm assuming what he was doing was that if that's your your intestine, and he's looking up, what he was doing was that he was effectively moving it round sideways and looking at it from the side, looking up. So what he was able to do was get like a sideways view. He says, so what I do is that I look at it that way, get the alignment that way, going in with the probe, and then I move it round to make sure I've got it right that way, he says, before I take the biopsy. I said, oh, very clever. Thanks for that, Now, what they do then is that they have to have an opening that they keep going in through with this biopsy tool. So they have a tube that's, when I say tube, it's obviously hollow, that allows this needle to go through its centre. So they put this in. Now, of course, he's going left and right side, so he's going to do this twice. And if you check it out, NHS websites, things, you'll see what they're like. And of course, but it's a bit more difficult to put in. Now, he says, I'm now going to put the tube in. He didn't call it that, he called it something else. He says, you'll feel a bit of pressure. And sure enough, because this tube's quite large and it's got to go through your skin and muscle. So it goes pop, pop, and I felt it, and you feel it go through the skin surface, the toughness, and then go through something else. So, it's not painful because it's all numb, 5 minutes worth. So he says, right, we're going to go in now. He says, and you'll hear a click. Most people jump when they hear it. And he says, you shouldn't feel anything, but if you do, let me know. He says, I'll put a bit more numbing, injection in for you. So, sure enough, he goes in, he says, right, I'm going to take the biopsy now. Click. And of course, it's like you just get a little, and that was a bit surprising, the feeling. It's no pain at that stage. But in mind, he's doing 15 of these. So he says, right, another one coming, now, click, up. So, of course, you start to then get used to it and you relax a bit. And you don't jump as much. So he says, right, done on that side. So he obviously pulls this tube out and he says, right, he moves around to the other side now. And he says, right, you're going to feel the pressure again. I'm going to put the tube in. Pop, pop. Well, it don't make that noise, but you feel it as though it's going pop, pop through the layers of your, perineum. I hope I'm not scaring you with all this. No pain when you feel it, just, it's a new experience. So he then goes in, he starts, another one, click, another one, click, and he's doing all these, biopsies, 15 of them. And he says, just a couple more now. And he goes in, and I says, that's, it's stinging. Okay, he says, just hang on. And he says, I'll put a bit more in, so he puts a bit more in. Now, what I didn't click onto when he was telling me earlier about all these, where he's taking all these samples, I think, and I'm not sure, I've got to check when I see the doctor or whatever, the urologist, I think he was taking a sample out of the semen. It's the gland that produces semen, and it didn't click at the time, and I've missed a bit, and I'll go back to that in a minute. But I think he was taking a sample in there, one of the biopsies, because when the when the cancer migrates out of the prostate, one of the places it goes is, and it's called something like a semen vestule or something like that, the name of it, which is the producer of the semen when you ejaculate. So, and of course, he goes in for this last one, and oh Jesus! And it wasn't just stinging; it was setting on fire. It was burning, And I said, "Christ! Oh, that's hurting!" I said, "But don't stop. Just keep going." I says, "I can stand it," sort of thing. And I'm gritting my teeth and sort of tensing my hand muscles and trying to keep my legs relaxed. So, click, and oh dear, that hurt. And that was the last one, and it's all finished now. Going back to when he was showing me how he targets, he then gets the laptop off the. So it's before he took all these biopsies I was talking about. He gets the laptop off the site, and he shows me the MRI scans. And on the MRI scan, you can see when the radiographer analyses all the MRIs, they supply all this information then to the urologist for it, so he can target these biopsies. And it's got a quite neatly outlined. It's not irregular, but it's round. It's a little bit irregular, and you can see it. It appears, because I'm not used to looking at these scans, but it appears to be set on the bottom of the prostate, and from what he was saying, it was anterior, which is at the front, and what he told me, it was on the left. So when we were talking at that stage, I said to him, that's sat right against the margin of the prostate. I says, is there any indication of migration? Yes, there is. So, oh shit. He says, in your lymph node, and I think he said, in the semen vestule. So obviously they weren't going to sample the lymph node, because that's further over in your pelvis area. But I think they were sampling the semen duct to see what's in there, to see if it is this. Because when they do the contrast MRI, as I told you in one of the other episodes, it picks out the blood flow. So if you've got a high blood flow rate, it highlights it in red colour, and they can see where you've got a lot of blood flow, and of course a growth or an infection, be it cancerous or whatever, in a gland or whatever, gets extra blood flow because the body's trying to do its thing against it. So the MRI contrast shows on this. So it's all very clever. Yeah, so after that it was, thank you very much, put your legs down, and how do you feel? Are you feeling dizzy? Which I wasn't, So go back, get dressed, have a cuppa, and she gives you a pad, and they explain, they say, put that between your legs, this one up your back end, this one up your front, because some of the gel might come out, and sit there 15 minutes, have your cup of coffee, and they give you some ginger biscuits, perfect, lovely. Some ginger nuts. So you sit there, and then after 15 minutes or so, the nurse came in and said, how you feel? I said, I'm okay, no problems. All right, you can go. So after that, no problems at all. I got home. Obviously, the numbing wore off, but no pain, not a great. And of course, they tell you what to expect in terms of bitter blood in your pee and in your semen and things. Yeah, so that's where we're up to. I'm currently 25 minutes. So sorry about this. So I'm now waiting of the biopsy results, which they said 3 weeks. What Verity explained was that what they do is that when they get the MRI results, the MRI results have to go into what's called an MDT meeting, which is a multidisciplinary. Was it MDT? Anyway, it's a multidisciplinary meeting, and what they do is that you get the urologist, you get the radiographers, you got the nurses. She said, I'll be in that meeting, Verity. And she explained that they all have all the professionals, all the people, oncologists, that was the other one, doctors, consultants, whatever, they all gather together and they have all the cases in files and they sit for a number of hours. They convene this meeting once a week or whatever, and then they go through all the cases and decide what the right courses of actions are. So, and what she said was that once they get the biopsies, they take, I think she says they have to dye them and put them in the lab system, which can take nearly a week. She says, so by the time they get those results, then they have to go off to, whoever. And then it has to go through the MDT meeting, multidisciplinary team. That's what it's called. That's why it's T. Yeah, so it has to go through the MDT meeting before you're seen by your specialist, your urologist, Nick. Sorry, I mentioned your name. I shouldn't have done that. Anyway, apologies. Good guy, Yorkshireman from Leeds. Cock on. Yeah, so anyway, so I'm waiting for that. Now there's my next one. I intend giving you some sort of some tips and tricks and things to remember and not to get too concerned about, because people say cancer, ooh, bloody hell, I'm dying. So anyway, can't look at it like that. But, early days yet, still waiting for results. So I'm going to take you through those as we go. I'll do another one, which, as I said, tips and tricks and my experience. And then I'll start doing them less regular, because I'll be waiting for scans, for, meetings, discussions with the urologists, and step by step where we're going. And just as a little teaser, in the next one, I'll be discussing what's called an orchidectomy. To you and I, castration. So, interesting, next one. Don't miss it. So, subscribe, like, that little thumbs up. Hit the bell notification so you get the next one when it's coming. It's an interesting little chat. Right, so we're up to just 30 minutes. I'm signing off now. Thanks for listening. Hopefully you find it interesting, and to all my siblings and family or whatever. Don't get worried. No point yet. Right. Chat to you all later. Bye.